Hi friends, once again welcome back to the channel. This is a very important notification of Government of India, Ministry of Health and Family Welfare. So what is the notification? This is the complete guideline. I can share the link with you. This says very important notification regarding vaccination for children 15 to 18 years as well as booster dose for health line workers and front line workers, also 60 plus senior citizen. So let us quickly see what are the important parameters of this notification. Okay, point by point, very quick video. This is a bigger document, but I am not showing or I am not discussing everything here. Only points will be discussed. So what are the points? First point, kids or children from 15 to 18 years, those children are going to get COVAXIN from 3rd January 2022 onwards. That means in COWIN portal the booking of the vaccination starts from January 2022 3rd. And one more point is, as of now they are going to get only COVAXIN. It is clearly told here. Okay, booking will be available only for COVAXIN. So what is the second point? Second point says health line workers as well as front line workers, healthcare workers and front line workers also will be getting booster dose. That means they have already taken first and second dose and they will be getting the third dose, basically booster dose, from 10th January 2022 onwards. So this is the date where the process will kick in. The real thing might take 1 or 2 days also extra, but 10th January onwards this process is chalu. Okay, it started. So but there is one condition: they should have taken the second dose 39 weeks before. That means you have taken first dose, second dose, after second dose, and 39 weeks later you are eligible to take third dose. And if you are a healthcare workers or frontline workers, and there is one more category included, that is 60 plus years senior citizen who has received 2 doses can also receive the booster dose, provided they should have a doctor advice on the comorbidities. Previously also this was the case where 60 plus was launched first with comorbidities. That means you have multiple diseases, like whatever it is, multiple diseases at a time, and you are looking for a booster dose. That is also possible with doctor's advice. So this is the third point. And as you can see here, that also will start from 10th January. Okay, and the priority sequence, all this government will take care. And clearly this also says that 39 weeks after second dose. That means 60 plus people also will be getting the booster dose after 39 weeks of their second dose with doctor prescription. Okay, now let us quickly see what are the details about children vaccination. So the first point says health line workers, all this is the COWIN provision features. COWIN is going to get added within 1 or 2 days. What are those things? HCW, that healthcare workers and frontline workers, and 60 plus. Okay, you can see here all 3 people are eligible for getting the booster dose, and they will be booking it through their existing COWIN account. That means they would have already taken first and second dose through COWIN. So that is possible. The third dose or booster dose also possible through COWIN account itself. And you have also provision to take out of COWIN. That means you can walk in. That is also there, because suppose you have not registered or not taken first 2 doses through COWIN, you can walk into the office also. That is also possible. And you can see here eligibility of such beneficiaries. Precaution dose will be based on the date of administration of second dose. That means you have, suppose 3 people are there, they are going to get booster doses. They will get preference, or queue system will be, preference will be available as per when did you complete the second dose. Okay, you have completed second dose prior before anyone else, then you get the first preference. That will be managed in the COWIN booking system. So next point says COWIN system will send SMS to such beneficiaries for availing the precautionary dose. That means you have taken second dose and 39 weeks is over, you belong to healthcare worker or frontline worker, you will get an SMS saying that you are eligible for third dose, booster dose, please come and take. So that SMS will be managed in the COWIN system. And next point says registration and appointment service can be accessed through online as well as on-site mode. Okay, this is the same point I am showing you again. Registration, you can see here, registration of booking of booster dose is available through COWIN as well as on-site mode. What do you mean by on-site mode? Suppose you are not booking through COWIN, you can walk into any of the vaccination center with your first dose, second dose certificates, and after 39 weeks of gap you can get on-site mode vaccination. That means you can walk in and take the vaccination. It's not a must that you should book it through COWIN portal. Okay friends, so now let us see what are the possibility for children like 15 to 18 years. These are the points. All children 15 years or more will be eligible to get COWIN vaccination, that means COVAXIN. Okay, but how they identify 15 years or more is birth year of 2007 or before. That means if your child's birth year is basically 2007 or 2006 or 2005, whatever before that, you are eligible because that person is considered to be 15 years above. Okay, so this is the first point. So only 15 to 18 years, or if your birth year is below or on or below 2007, your kid is or your child is eligible for the COVAXIN online. So how to book COVAXIN? Clearly it is told beneficiary can self-register online through existing COWIN account. Clearly it is told, okay, online through existing COWIN account, or you can register by creating a new account. That means suppose parents have already taken vaccination, that is possible through COWIN, and you wanted to register your child who is 15 to 18 years, you can use the same account of parent and add your children and get vaccinated. And suppose you are not having those provision, or if your account has already full with vaccination, you can create a new account with a new mobile number and add your kid for vaccination. Simple. Both options are available. Okay friends, and through a unique mobile number is also possible for all eligible citizens or children. Now such beneficiary can also be registered on site. See here, this is also clearly told. That means if you are not registering to COWIN, you can walk in, you can visit any vaccination center and get your child vaccinated who is 15 to 18 years of old. Okay, appointment can be booked online or can be on site walk-in. Clearly they have mentioned here, so it's up to you, but I suggest you to book through COWIN and go there so that your schedule will be booked, everything will be tracked, because previously people has faced a lot of issues when they walk in. Many has lost their certificate, or certificate is not linked with COWIN. Sometimes vaccinator misses to information, upload your information in COWIN. So the best way is book through COWIN and walk in. That is the best way I would like to advise you, so that you are not having a trouble later tracking your certificate and stuff. So what is the last point? Last point is here. For such beneficiaries, option for vaccination would be available for COVAXIN, and this is the only vaccine for 15 to 17. So as of now, children or child will get only COVAXIN. It might come later another vaccine or some other vaccines, but as of now, when you are booking a vaccine for your child who is 15 to 17 or below 18 years, you are going to book only COVAXIN online. Okay, and clearly it is told these guidelines will come into effect from 3rd January 2022. So as soon as they push these COWIN features, we will push the videos on how to book vaccination for your kids or senior citizen 60 plus. We'll be pushing more videos. If it is already pushed, you can watch. I'm adding the slide here. If you get a link, or the final, after watching this video you may get a link for knowing how to vaccinate your child. Please watch it and take care accordingly. Thank you so much. If you like the video, kindly give us a like. Also please share and subscribe. See you with more informative videos.